All right, we're going live. Good afternoon, everybody, and thanks for joining us for this program that we're doing within partnership from the Dallas Public Library and the Office of Environmental Quality and Sustainability. Today, we're going to be talking about air quality. But first, I want to do a couple of housekeeping notes. First is that this meeting will be recorded. You may have seen a pop-up when you join the call. So if you don't want your likeness to be shown on our YouTube channel or subsequent recordings, you can go ahead and turn off your video. Also note that participants will be muted during this call so that you can keep the focus on our presenters and the great content they're going to share with us. So if you do have any questions, you can put those in the chat and we'll get to those at the question and answer portion. So without any further ado, I'll throw it over to Kevin, who's going to introduce our guests and get us started.
Thank you, sir. I'm Kevin Overton. I'm a senior environmental coordinator with the Office of Environmental Quality and Sustainability. And my specialty in that group is air quality. And just in case anyone doubts the importance of air quality, yesterday we hit some, as most of you probably know, we've been under ozone action days for several days. And yesterday we had one of the highest ozone readings that we've had in a very, very long time. Mostly it was in the western part of the Metroplex in Western Fort Worth, but they hit readings of over 114 parts per billion yesterday, and that's quite high. So I think that this discussion that we're having today is going to be very timely and very important. And we have a couple of different topics that we're going to talk about today. First, we have Gerardo Acosta from EPA Region 6, who's going to talk to us about environmental justice. And then we're going to follow that up with Dr. Kathy Jack from the Nature Conservancy, who's going to talk about a project that we've been working on with the Nature Conservancy called Breathe Easy Dallas, and I'll wait and tell more about that. First, let me give you a little bit of information on Mr. Acosta. He joined EPA Region 6 in 1995 and has worked in a lot of different ways as an inspector, enforcement officer, team leader, and other things. He has worked in air quality and drinking water, emergency planning, and a bunch of other topics that I won't bore you with, but just suffice it to say that he is very qualified. One of the things that I think is really great is that he serves as a volunteer speaker promoting EPA careers in science, technology, engineering, and math, STEM, at all levels in the regional public and private schools. That's something that's near and dear to my heart. I wish they would have had something like that back when I was in school. I would have been made me even nerdier than I am now, more than likely. He began his career working for the Cooperative Extension Service in Puerto Rico, supporting local farmers and compliance with environmental regulations. He has a BS degree in agricultural science from the University of Puerto Rico, Mayagüez, and an MS degree from A&M Commerce. And in his spare time, Gerardo coaches for a local volleyball club in Mansfield. So with that, Gerardo, I'm going to turn it over to you and let you take us and tell us what you need to do.
Thank you, Kevin, and thank you everyone for hosting us here. First of all, you hear me okay, Kevin?
Yes, sir, can hear you fine.
Okay, good. I hear you fine as well. So thank you, and good afternoon, everybody. As Kevin mentioned, that was a humble introduction, so I appreciate those remarks from Kevin on this topic. And I have been with EPA Region 6 in Dallas since 1995, and currently I work as a staff director for the Office of Communities, Drives, and Environmental Assessment at EPA Region 6. And today the topics will be environmental justice and some executive orders that we have gone through as this new administration is on board beginning of the year. So first of all, the EPA Administrator Regan message to the agency was pretty clear. while EPA has advanced environmental justice initiatives in the past, we have much more work to do. Too many communities whose residents are predominantly of color, indigenous, or low income continue to suffer from disproportionately high pollution levels and the resulting adverse health and environmental impacts. We must do better. This will be one of my top priorities as administrator, and I expect it to be one of yours as well. So with that, he gave us a pretty clear mandate of what exactly are his priorities, and EJ, or environmental justice, as I will refer to in this presentation, EJ again will be a top priority in the administration of Mr. Regan. So with that, if we wish to understand about EJ and what it means, then we'll start thinking about those terms, and we start thinking about fair treatment, meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to development, implementation, and enforcement of those environmental laws, regulations, and policies that we are, in charge of making sure that we fulfill our mission of protecting human health and the environment. So with that understanding, now we go into definitions of each of those terms. If we think about environmental justice community, we are thinking of a minority and or low income community plagued with one or more environmental problems, whether it's air emissions, solid waste management, land emissions, water discharges, any of those affect those communities. Now, when we break that down into minority, that means the community is either 50% minority or its minority population is 20% higher than that of the state or county where the community is located. And then we consider low income, and that is designated for each year by the US Census. If the community has the same or greater percentage of residents at the current poverty thresholds, and for 2020, the poverty threshold for a family of four was $26,695 per year, and that was considered low income. So now, let's focus on what our office does to assist those communities. And we have three different types of grants that we provide to those communities to help them, become sustainable and help them, in those environmental concerns. One of those grants is the EJ, or Environmental Justice Small Grants. That supports and empowers communities working on solutions to local environmental and public health issues. These are one-year projects for about $75,000 per project. And the most recent request for proposals was already closed. This request for applications was closed on June 1st, 2021. And currently, the agency in headquarters is reviewing over 300 applications that they received on those. So they are busy. The next grant is the Collaborative Problem-Solving Cooperative Agreement Program. This one provides financial assistance to eligible organizations working on or planning to work on projects to address local environment and or public health issues in their communities. These grants are for $200,000, and they are expected to last 2 years. And the request for applications again closed in June 1st of this year. And once again, we received over 300 applications for that as well. The third grant is the State Environmental Justice Cooperative Agreement Program. This provides funding to eligible applicants to support and or create model state activities that lead to measurable environmental and public health results in communities that are disproportionately burdened by environmental harms and or risks. Now, these are a little more in funding. They are $1 million for 2-year terms. And as you see, the common theme here is that we're trying to address local and environmental public health concerns from those communities so that they can be the ones addressing those concerns with this funding. So that's one avenue for us to help out in terms of in the EJ communities or communities with EJ concerns. And now, this year, as soon as President Biden became president in office, he started signing several executive orders. I'll discuss two of them. One of them is advancing racial equity and support for underserved communities through the federal government. The other one is taking the climate crisis at home and abroad. And so he not only issued those executive orders, he also created a White House Environmental Justice Interagency Council that is going to bring the EJ topic in a whole government approach. We wanted to have not just the EPA look at it, but also other agencies to help out address these concerns from these communities that have been, disadvantaged or disregarded in the past. So with that, we have also the White House Advisory Council on Environmental Justice. And those two entities will work real close with each other to help address those concerns. And not only do we have those entities, but we also have another funding from Congress that comes straight from Congress to everyone. And this is the American Rescue Plan Act of 2021. This was signed on March 11th of 2021. And it assigns $100 million to EPA just for environmental justice. And it goes to many different programs, whether it's water, air projects. Any of those actually can participate on this. So let's go over these executive orders in more detail. The executive order, first one I mentioned is Executive Order 13985, the one that advancing racial equity and support for underserved communities, was issued in January 20 of 2021. The goal was to pursue a comprehensive approach to advancing equity for all, including people of color and others who have been historically underserved, marginalized, and adversely affected by persistent poverty and inequality. It affirms advancing equity, civil rights, racial justice, and equal opportunity were its responsibility for the whole of our government. It recognizes that advancing equity requires a systematic approach to embedding fairness in decision-making and redress inequities in policies and programs that serve as barriers to equal opportunity. The other executive order that I mentioned, this is Executive Order 14008, which is tackling the climate crisis, home and abroad. Section 219 of that executive order discusses how we're going to be achieving environmental justice to be part of agencies' mission by developing programs, policies, and activities to address the disproportionately high and adverse human health, environmental, climate-related, and other cumulative impacts on disadvantaged communities, as well as accompanying economic challenges of such impacts. It secures environmental justice and spur economic opportunity for disadvantaged communities that have been historically marginalized and overburdened by pollution, and on their investment in housing, transportation, water, and wastewater infrastructure, and healthcare. It consults with members of communities that have been historically underrepresented in the federal government and underserved by or subject to discrimination in federal policies and programs. As we continue the next section of this executive order, it elevates the Federal Interagency Working Group on Environmental Justice. And this is where they now become the White House Environmental Justice Interagency Council that has representation from 11 plus federal agencies and various White House offices. It was tasked to develop clear performance metrics to ensure accountability and publish an annual public performance scorecard on its implementation. It held its first meeting the week of April 1st. and I'm sure they're real busy after that meeting. Now, the next section of that executive order, it created the White House Environmental Justice Advisory Council, or what we call the WEJAC. Its members include 26 representing various stakeholders. They include tribal government, indigenous organizations, and local community organizers, or EJ stakeholders. They advise the chair of the Council on Environmental Quality and the White House Environmental Justice Interagency Council. They held their first meeting on March 30th, which was open to the public. The previous meetings were held before April 28th and May 13th. And by the way, we have had at EPA the National Environmental Justice Advisory Council from the, I want to say, mid to late 90s, and they are still a big force in addressing environmental justice issues. And as we speak today, they are currently meeting with their, I want to say, their third meeting of the year, or second meeting of the year. And those meetings last whole afternoon. You have to sign up, and they get you to time to speak in front of this audience, and then they record the notes, and they try to address all those concerns with those entities that need to be heard about. Now, let's discuss about this American Rescue Plan Act. In Title VI of the law, it provides $100 million to EPA to address health disparities resulting from pollution and COVID-19, which was a major challenge for everyone last year, and it still is for some agencies and some individuals. It provides from that $100 million, $50 million is for grants, contracts, and other agency activities to identify and address disproportionate environmental and public health harms and risks in minority populations of low income or low income populations. Please forgive me. It pertains to various EPA programs, including retrofitting or replacing of those diesel engines and equipment. It addresses brownfields redevelopment. It helps on technical assistance for small community water systems and so many other things that it helps with. And then other 50 million of those are from grants and activities authorized under the Clean Air Act that are related to air quality monitoring and the preservation and control of air pollution equipment in those communities. So with that, I gave you a quick, very high level overview of the EJ program at the EPA, and I'm open now for questions from the audience.
Great. Thank you, Gerardo. Got a couple of questions here. I guess the first one should ask is especially with regards to the small grant program, the first grant program that you mentioned, who all is eligible to apply for those grants? I mean, and particularly, I think the person that asked the question is coming from a perspective of a local community environmental organization. Okay.
I think we have a website. I can put that in the chat for you to share with everyone.
Sure.
And but basically, I'm just going there because I don't want to mislead anyone on this response.
Okay.
And so those eligible organizations are incorporated nonprofit organizations. They include, but we don't limit those to community-based organizations, grassroots organizations, environmental justice network, faith-based organizations, and those affiliated with religious institutions. It applies to U.S. territories, tribal governments, either federally recognized or state recognized, including Alaska Native or villages. It includes tribal organizations, and it also includes freely associated states, including those state and local government entities and local nonprofit organizations in the federal states of Micronesia, Republic of Marshall Islands, and Palau. So as you see, it's real broad as to these organizations that are eligible to apply for these grants. Does that answer the question?
That helps. Let me ask a follow-up because I think it would be great if more organizations in Dallas were to take part in this program. What kind of things do you award grants for? Just to kind of get, is there something you can do to kind of give people an idea of what kind of projects or things that they might that might be of interest to the EPA? Because as you said, you get a lot of these applications. So what would stand out to you as something that would be a good project?
Well, you know, I can tell you about past projects. I
Yes,
can
sir.
tell you about those that have done before. And I think there was one in New Mexico that they were rebuilding a garden that was about to fall out, and they were trying to keep it together. And the benefit of this, you know, what we're going to call them EJ small grants, is that you don't have to depend only of this funding, but that funding can leverage other people to help out. And this was exactly the case of this community. I want to say it was Still Women in New Mexico, an organization in New Mexico that is, again, nonprofit, and they were trying to address this erosion of this garden. And I don't want to give you the numbers because I could be, you know,
Right.
off by a few
No,
thousand dollars.
Yeah.
But they were able to leverage, you know, that funding into other entities to help out and build this garden into now something that they have the community come in and help out and build on that and become sustainable.
That helps. I guess the other question that I see here that's kind of pertinent is someone asked if their community is experiencing some fallout or impact from environmental justice. Is there someone at the EPA that they can call or departments? Is there someone they can get in touch with to help them out? How does that work? Do you guys take direct action, I guess, to fix environmental injustice issues?
Thank you. Great question. You can send those inquiries, and this is what I call them. They're inquiries from those communities to me. We can, you know, coordinate. The way we do this normally, we coordinate with local, state, environmental department of, you know, whether it's in Texas, New Mexico. By the way, our region covers Texas and all the states around Texas. So if that inquiry comes from those particular regions, we will coordinate with the state agency that has jurisdiction over that, you know, particular section, as well as within our regional office that may have something that, you know, will contribute to that. For example, if there's a concern from a community in Louisiana, then we'll coordinate with the Louisiana Department of Environmental Quality to see, okay, what have you done on that facility or on that community that may already be responsive to that. And then we work closely with them to make sure that those community concerns are addressed and, you know, fulfilling our mission to protect human health and the environment.
Is it okay with you if I put your email in the chat?
Of course, you can put my email and my phone number. I think you have that on my signature block.
I do.
The way we have in my office, I cover environmental justice, environmental education, and tribal affairs. And so we get the information and we work with many divisions and provide, you know, the assistance that we are, you know, supposed to provide to, again, help fulfill our mission of protecting human health and the environment.
And I believe I have just put those numbers and information there in the chat. So if anyone is interested in getting in touch with you, if you get overwhelmed with phone calls and emails, don't blame it on me.
That's okay, Kevin.
Appreciate the information. That was very good information, especially about the grants. The only disappointing thing is that we've all missed the deadlines and we have to wait 12 months to do this again, but we probably missed the boat on a couple of those that we could have probably come up with some applications for that. Probably Kathy could have too, but we'll see. Anyway, so I think with that, like I say, I appreciate your time. That covers most of the questions that I've gotten in today. And without further ado, I'm going to switch gears, and we're going to talk about Breathe Easy Dallas. And one of the reasons I wanted to pair these two together today is because I think Breathe Easy Dallas is a good example of the city of Dallas being proactive in environmental justice communities. And I think once Kathy starts talking about this program, you'll understand why. Let me give you a little brief introduction. It's been my pleasure to know Kathy Jack for probably 3 or 4 years now, but Kathy has been in the environmental business for a long time. She brings more than 20 years of experience as a research and program manager, working at the intersection of environmental technologies, sustainable development, and community health and resilience. She is the Dallas Healthy Cities Program Director for the Nature Conservancy. She has a Bachelor of Arts in Environmental and Society from Cornell University, an MS in Resources Engineering with a specialty in International Development Technologies from Humboldt State University, and a PhD from the University of North Texas. And I know that she also doesn't put this in there. She's probably embarrassed about it, but she also used to be an environmental coordinator or scientist with the city of Denton. So she has a lot. We have a lot in common with Kathy, and it's been a pleasure working with her. Also want to introduce Dr. Haneen Kreis, and let me pull Dr. Kreis's biography up. Dr. Kreis is a cross-disciplinary professional in health impacts of transport and planning and policy. She has training in transport planning and engineering, vehicle emissions monitoring and modeling, air quality monitoring. I'm not going to go through all of this. Let's just say that Dr. Kreis is one of the most brilliant and qualified professionals in environmental that I have ever known. It's been working with her is a pleasure. I always learn something new when I work with Dr. Kreis. Dr. Kreis is currently an assistant research scientist at the Texas A&M Texas Transportation Institute and at the Center for Advancing Research in Transportation, Emissions, Energy, and Health, which we abbreviate CAR-T, and she remains an associated researcher at the Barcelona's Institute for Global Health. I'm going to turn it over to Kathy, and I believe Dr. Kreis will be joining Kathy in to help answer some questions and taking part in the program. So Kathy, all yours.
Okay, I'm going to share my desktop. I want to know if you can see that. Is that visible to everybody? Kevin?
I'm checking. Hang on.
It looks like it's still loading for us.
Yeah.
Let me know. I can see the presentation. That doesn't help us very well.
Yeah, it looks like it may have gotten hung up. Can you stop sharing and reshare?
Yes,
just
sir.
to see if that'll work, because it worked when you did it just fine.
It was working earlier.
Yeah, looks like it may just be kind of hung up.
I'm going to do something here.
Here we go. All right, you can reshare.
Reshare. I'm a little bit worried. I should have sent this in advance to Kevin.
Nope, we see it perfectly now.
Okay, we'll see how we go. I'm having internet issues, which is, of course, to be expected. So thank you so much, Kevin and Brittany. Susan isn't on the call with us. It's just been a tremendous pleasure working with the city. Particularly, we've worked with the Office of Environmental Quality and Sustainability on this effort since 2017. It's been a fantastic project. I'm also pleased that Haneen, Dr. Kreis, is here with us. She's going to save, I've invited her to jump in if I misrepresent anything scientifically, and then she'll be on for any technical questions at the end. But this project is just one example of TNC's commitment to working collaboratively with our conservation partners, health partners, and local government partners to often use nature, but not always just nature. Can you all see this or still hear me? You can still hear me. It looks like it's going to keep rebooting, so I'll just keep sharing. I apologize. To use nature as well as other solutions to improve community health and resilience. So as long as you all can hear me, I'll just hopefully keep plugging along.
Kathy, we can hear you fine. Is there a way you can turn your camera off? It might save some bandwidth.
Oh, yes, absolutely. Hang on. There. Okay.
See if that works better.
Okay, so the goal of this project, we have a number of goals, but the overarching real big goal for Breathe Easy Dallas is to develop a project that will collect actionable science, applied science that will support improved outcomes for Dallas residents most at risk for adverse health impacts, including asthma, from poor air quality. We seek to improve the health, education, and social outcomes for Dallas children that are at high risk from asthma, and improve overall air quality for all of Dallas residents and communities. So just off the top of the bat, I do want to recognize that we've developed this project from the beginning with many partners, but our closest partner has been the City of Dallas and the Office of Environmental Quality and Sustainability, because of their commitment to understanding how we can use low-cost sensors to get meaningful data that'll improve the lives across Dallas, in particular for those residents that are really challenged with health problems that we believe are tied to air quality. So this project is written into Resilient Dallas. It's also written into the recently, well, now it's been a year since it's been passed, the Dallas Comprehensive Environmental and Climate Action Plan. And some of the background is that this all started back in 2017, and actually for many partners, this started beyond 2017, because we have partners including Children's Health, Parkland, the city, and others who've been looking at air quality issues or asthma issues for many years. But we had a convening in the fall of 2017 where we brought air quality experts, educational experts, and public health experts together in one room to sort of look at this intersection of air quality and pediatric asthma. Many folks had reported for years that air quality was we already know air quality is an issue, like Kevin mentioned, but we had been looking at this intersection between asthma, which is a real issue in Dallas, and air quality. So we brought all these folks together to kind of move the ball forward and to fund a project that would help us all get some intersected data on air quality and health. So just quickly, and this is Dallas, the challenges as we frame them up. Dallas has a persistent problem with poor air quality and pediatric asthma. The region consistently fails to meet regulatory limits on ozone pollution. And also, according to multiple health researchers, the DFW area in Dallas far exceeds both the state and the national average for rates of childhood asthma. Dallas County has led the region for hospitalizations from childhood asthma, and respiratory issues are a leading cause of absenteeism among students in the school district. I will say that second part of that clause, respiratory issues are a leading cause of absenteeism. We've really, one goal of this project is that better data will start to be gathered within the school district itself to actually quantify that. They don't actually have data that says this is how many students each year are absent due to asthma, but they do have data on the number of children and students in DISD schools that are diagnosed with asthma, and they have strong qualitative data based on Children's Health Services in the district on the problem that is within each of the schools. So why this is being paired today with our U.S. EPA Region 6 talk on environmental justice is that we know not all families and children are impacted equally. We have local practitioners in Dallas that say our southern sector families are particularly hard hit with this issue. We also have data from the CDC that finds in the United States, Black children are twice as likely as white children to have asthma and with greater severity. And what that means is experiencing higher than average rates of hospitalization, ER visits, and even death from asthma. And then we have a body of recent research that further demonstrates a link between asthma and an increased likelihood of falling into poverty, which is very concerning because that means that children with high rates of asthma can be more likely to have lifelong issues and barriers related to outcomes from their childhood disease. So my bullets are out of order on this slide, so I'm just going to make them all pop up. So more on the challenge. These stakeholders recognize that there's an opportunity to get more data and better data to work collectively to address air quality issues that have health impacts. They also acknowledge, and this was 3-4 years ago, that we did not have good comprehensive data that connects air quality across multiple pollutants at the local level and in a distributed fashion across the city. And we don't have data that can connect in a way that is spatially explicit, so we can connect air quality data, local variable air quality data to pediatric asthma or other public health outcomes. We do have very rigorous regional airshed level data on ozone, but we don't have what we need in a distributed fashion across the city. So the opportunity is, in recent years, there's been multiple companies have developed these small, low-cost, portable air quality sensors. People, community scientists have been very interested, as well as researchers, on how can we deploy these low-cost sensors to answer very important public health questions. How does air quality vary across the city, and how is that linked to health data? So more and more, we're seeing these monitors distributed in networks across areas to study air quality and their links to public health. Now, early research, and Dr. Kreis and her team did a thorough review of all current research, shows that from unit to unit and producer to producer, there's quite a bit of variability. So we really wanted to not only understand the public, how air quality varies across Dallas, but we really needed to understand first, how can we interpret and use the data that they collect in a meaningful way? So here are those 2 points. How can these units best be used to gather meaningful data on air quality and public health? And how can we then use these monitors to gain actionable data for all of our goals in Dallas? So here are all of the sub-goals, and I'm not going to read this whole list to you. I'll let you look for yourself. But basically, we want actionable data. We want to understand how to use low-cost sensors for public health, and we want to gather that data to understand the context of Dallas, and we want to share the data from all of this research with other areas, local governments in the region, and other areas looking at this problem across the country and the world. So we have 4 major bodies, or 2 major and then 2 other additional bodies of research associated with Breathe Easy Dallas. And I'm going to go into more detail on the first 2, which is we have 2 big studies, overarching studies. One is an analysis on how these units perform and how to use them. And then the second piece of research is a geospatial study about air quality in Dallas and how it ties to pediatric asthma. Within those 2 main bodies of research, we have a sub-study where we will work with our partners at the Texas Trees Foundation to study the air quality benefits of 1 or more vegetative interventions. And then also our partners at the Texas Trees Foundation will be sort of taking on 3 of the monitors to look at longer-term impacts of their large-scale greening projects at the Southwest Medical District. So the first study, TTI, has just wrapped up in January, and that was we for 18 months had this is a picture of 12 units installed at one of the regulatory air monitoring stations managed by the city through a contract with the with the TCEQ. So that is a very expensive, high-performing air monitoring station, and we wanted to compare data that was continuously gathered by these small monitors over a long period of time, again for 18 months. We gathered data on these pollutants: ozone, nitrogen dioxide, particulate matter, both 10 and 2.5. And then we also gathered data on temperature and relative humidity, just to understand how do they perform in various conditions and how do they compare. And then with that data, how can we recommend the data be interpreted and these monitors be used in the field, including calibration recommendations. The key takeaways here are, though there was variation over the course of 18 months with the absolute air pollution readings, and there was various accuracy between the different pollutants measured. So there was variation and across different conditions between, if you were to look at the absolute measurements of these various pollutants, there was variation between these pollutants and the measurements and the regulatory monitor. However, the sensor's readings tracked the reference monitor trends, which is very important, and they really were in sync with each other. So that was important so that you could compare across the city. Also, the low-cost air quality sensors, they were able to more accurately present their data if you lumped ranges of the values within, for example, the US EPA's air quality index. So this visual that you see here shows there is a series of calculations where you combine the readings on variable pollutants and you calculate a score, an index, and then you use that range. And if this calculated score falls within, for example, 0 to 50, you have good air quality. 51 to 100, you have moderate. And the application, you keep carrying on, then lets you make some public health recommendations for the state. And many of you may have seen this with Arlo the armadillo. We have alerts that are tied to red, for example, as unhealthy air. So TGI found that rather than using the readings from these low-cost sensors and the absolute values, you should be performing the calculations to report out in the range of AQI, which we thought was very important. They also found that really there is value in broad deployment of these low-cost sensors, as well as you followed calibration schedules and reported out the values in a range, such as the AQI index, rather than absolute values. And we hope that now the second phase of research can operate and take these recommendations to better understand the air quality across Dallas. So now I'm going to give a snapshot of the next study, which is really the incentive for the first study, was to understand how we could use the monitors in the field. We have a year-long study that's going to measure air quality and characterize air quality for these same pollutants in several sites across town, and then correlate those readings to health data for pediatric asthma. So the first goal is just to gather high-quality local data across these pollutants in different sites across town and understand how the air quality may vary in these different locations, and then to contribute that data to local and regional data sets. And then the second goal is then to understand the relationship between the air quality and other public health data, including pediatric asthma. Here you have a map of all of our sites. The purple sites are not a part of this one-year study. Those are the 3 Southwest Medical District sites that will continue on to gather data beyond this 1 year, this pediatric asthma study. But those sites will be used to really understand the data now, and then after the Southwest Medical District starts to put in several greening interventions. The remaining sites include 5 sites where we have used multiple sources of data, including data from Children's, Parkland, and the school district, to understand, and the county, to understand where we have several sources of data showing that we have high rates and high risk for pediatric asthma. So we deployed neighborhood air monitoring stations at 5 of these high risk, high poverty, and high rates of asthma locations. Then the green sites, these 3 green sites, are where those same sources of data showed us that we have really low rates of pediatric asthma, low rates of poverty, and low risk. And then the one blue site that you see here, we had high rates of pediatric asthma, low rates of pediatric asthma, but high poverty, which was different than the trend. So for 1 year now, we will continue to collect continuous air quality data at all of these sites. And then at the end of the year, TTI will analyze for trends and report out. And this is just another listing of the exact sites, one of which was, this is installation day at X-Line Recreation Center in South Central Dallas. So that's it. I'm gonna, I don't know if I should leave up. I'm gonna put on my camera again if I should stop sharing or keep it up in case there are any questions where we would need to reference a slide.
I think you can keep it up. It seems to be working pretty well right now. Let me look at my notes here. We had some questions coming in. One of the questions, and you may have answered this as it went along, but someone wanted to know, how is this data used? And they also wanted to know, what does it mean to them?
That's great questions. And I think there's a few points. And actually, I think part of it is a TNC response. Part of it is a Dr. Kreis from TTI response, and part of it is the city. From TNC and TTI's perspective, we wanted to complete this 1 year analysis. Part 2, which is the 1 year analysis. Part 1 was, we really want to understand, as more and more communities are trying to use data to say you have a child with asthma. Folks are wanting to understand, what is a red reading mean from these monitors? What does that mean for the health of my child? And we wanted to understand, do we report the numbers that we're seeing on these monitors? How do we use them? And so over the course of this first phase of research, we think we have a way where you can translate data from these, similar to the Armadillo data, and say, hey, in these areas, we have data that shows you may want to take action to protect the health of your sensitive population, which is what the AQI index is for. Part 2, the long-term research, is trying to understand, do we see a correlation in Dallas, specific to Dallas, with these high rates of pediatric asthma and air quality? So that's the first question, and we'll know that after we collect, or we'll know more about that after we collect a year's worth of data. And second, what are the trends that we're seeing? And third, we have now turned these monitors over to the city because they have a longer term commitment to using these monitors for public health objectives. So I guess what I'd like to do is ask if Haneen has any more of a response to add, or Kevin from the city's perspective.
I'll let Haneen.
Yeah, I think you covered it well, Kathy. I don't really have anything to add. One potential end use that's not exactly what we're looking at right now, but it can come in the future, is to use it the same way like the EPA uses the AQI in certain areas to communicate to the public the health risks and the state of the air quality in their neighborhoods. But besides that, I don't really have anything to add.
Yeah, I would just say, from the city's behalf, we're still exploring the different ways that this can help us. And I don't think we have everything nailed down, but I will give you an example that yesterday, when we had these very high ozone levels, it was very nice to be able to go in to see if it was as widespread as we thought it might be. And yes, it was widespread, but there was a lot of variation in the different neighborhoods between ozone levels. Everybody was high, but some were higher than others. And the main monitors that we use to track these pollutants are very far apart and not really well distributed. So I think that one of the things that in the future that this can help us do is better understand if there are some areas that are routinely experiencing high pollution or higher pollution than others, and maybe we can find out what's causing that. That would be the ultimate goal.
And if I could just add one more closing point to that question is that, when we started this project, the obvious, interest and need for something like this was we really want to understand how air pollution varies across the city and whether any variation may be causing health impacts.
Yes.
But once we got into this project, we realized because this technology is such an early state, there was really a need in the field to advance the research and the findings around how to interpret the data. And that, I think, is really one of the biggest values. It's not as exciting, I think, for maybe many folks in the community to understand, but it is very important. We really just had to slow down and say, wait a minute, how do we, in a meaningful way, use the data deployed in these low-cost sensors? And that, for me, has been one of the most exciting outcomes of this first phase of research.
I agree. This next question kind of takes us back to a real basic level, and this may be a question for Haneen, or you may be, we'll see. How does air pollution affect asthma? And what pollutants are, and I'm kind of paraphrasing here, but what pollutants are important in looking at asthma?
That's definitely a question for Haneen. That's her body of expertise.
Yeah.
Passing the buck, Haneen.
Yeah, okay. So, I mean, to, I guess, briefly summarize it, I would say air pollution affects asthma or childhood asthma. We're specifically interested in pediatric asthma in this project. It has an effect on adults' asthma as well, but I won't talk about it unless people are specifically interested in it. But for pediatric asthma, it affects it in two key ways. The first one is it exacerbates pre-existing asthma by making it worse across a variety of different outcomes, including increasing rates of hospitalizations, increasing rates of medication use, increasing the amount of medication, increasing doctor's visits, emergency department visits. So all of that, there's a lot of research to show these associations, and we know very well that it makes pre-existing asthma much worse. It also has a different kind of effect, which is more of an emerging body of research, which is that we think it elicits new cases of asthma in people who didn't, or in kids who didn't have it at baseline. So if a child is exposed to certain levels of air pollution chronically, specifically in their early years of life, their risk for getting new asthma increases compared to children who are not exposed to the same air pollution levels. In terms of which air pollutants we think are most important, there's really a lot of controversy, but what I see from my research is that the traffic-related mixture in particular seems to be more important than other mixtures, although we really can't say that with a lot of certainty, but I would say particulate matter, specifically the fine particles, nitrogen dioxide, but specifically as a marker of the traffic-related mixture, are important in the onset of childhood asthma, while ozone and particles are important in the exacerbation of childhood asthma. That's it.
Okay, that's good.
I can go on about this, but I won't.
So to make sure I understand what you're saying, ozone is important in it. Well, take it back. You said that oxides of nitrogen and PM were important in the early stages when a child is developing asthma, but then ozone, it makes it worse. Days like yesterday, for a child that has asthma, ozone makes the problem worse. Is that Am I paraphrasing that correctly?
Yeah, it seems that way. It seems that ozone is particularly harmful for people who have already asthma by exacerbating pre-existing asthma. For those who don't, who might be susceptible to developing it, it seems like particles, both PM2.5, PM10, and ultrafine particles, in addition to nitrogen oxides, which are really just a marker of traffic, are more important. It seems that way.
Very good information. All right, Kathy, I guess we got to talk about this one. How did you decide where to put the monitors?
Absolutely. And this was, this took a very sophisticated level, multiple sources of data. We had 4 main sources of data, 5, and then a cross-check with a 6th. So we used public health data from Children's and from Parkland, but Children's was the first source that had, for one year, I think it was actually 2012 originally, they had, for pediatric cases aged 18 and less for the city of Dallas, they had annual visits to hospitalizations and visits to the ER by zip code. Then we also had Parkland released a series of data for their pediatric patients that listed the highest rates of diagnoses for high-risk asthma by zip code. We also used a county source of data that just illustrated across the board, not specific to asthma, the biggest burden zip codes in Dallas for all health considerations. Then we also had a year's worth of data from DISD that was just children diagnosed with asthma. So based on information that they had for that one school year, how many children at each school, all K through 12 schools, 228 schools. Then we went through a period, and Haneen, I'm going to have her close the loop after I just say the high level. We wanted to focus on the children, the age group that was the most susceptible to asthma. So we decided to look at areas of Dallas where we started to look in neighborhood sites that were close to schools, because the schools were one of the sources of data. So we started by looking at elementary schools, and we included looking at areas where there were safe routes to school. So we did another pass, besides looking at just the health data, where were children walking to school, potentially near roadways. So we asked the city to do a cross-check of all of our data with safe routes to school, and then also with places where we may have already dedicated funding for some interventions in the future, for example, with perhaps vegetated interventions. So we looked at multiple sources, but we only had limited funding, so we knew we were going to have to pick 9 locations, 9 neighborhoods. And then I'm going to ask Haneen, if I don't say this clearly or accurately, to revise it. But the idea from a scientific and statistical perspective was to select 5 neighborhoods where we had the highest likelihood of high numbers and high risk for children with pediatric asthma. And then for a control, to compare air quality in those locations to areas where we had the extreme other end, the lowest likelihood of prevalence and risk for childhood asthma. And poverty was considered an important factor in both of these locations. So we had high rates, high risk of asthma, and high poverty on the one spectrum, and low poverty, low risk, low rates of pediatric asthma on the other end. And that was the major driver on our site selection. But then there were also practical considerations like poles where we could install the monitors and whatnot. Anything else, either Dr. Kreis or Kevin?
No, Kathy, you covered it very well. The one thing I would say is not exactly about how we selected them, but kind of why. The whole idea of increasing the contrast between the high risk versus the low risk is because that statistically gives us an advantage to detect the differences. While if the differences were smaller and more subtle, the effect of confounders and other factors that we cannot control for in our analysis might kind of overshadow what we're trying to see or what we're trying to investigate. So, and of course, there's an environmental justice question right there as well. So that's all I wanted to add.
Thank you. Kevin?
Add to that other thing, and it was an interesting experience going through all of this. It was, you know, as someone who was a science major and started doing graduate work but never finished, and has been working in industry for all these years, it was a exciting thing for me to be able to go and actually do real science again. It was actually kind of fun, I think, in a lot of ways. There was a lot of roadblocks, but it's been a lot of fun. I'm going to go ahead and ask this last question. I don't know if you're going to be able to answer it or not, but I think it deserves the person to ask it deserves for it to be asked. And that is there any early trends or anything that you have seen from the data that you can share with us today?
That I'm definitely going to ask Dr. Kreis to report, because we've had the neighborhood, or you, Kevin, you and Dr. Kreis are much more familiar with the neighborhood level data. I'm more familiar with what we've found from the first, from just the performance. So I'm very reluctant to say anything about trends until we get a full year's worth of data. But I am also eager as the person who asked. So either Haneen or Kevin, if you feel comfortable sharing any indication, are there any early lessons from the data at this point?
Yeah, I honestly cannot comment as to the neighborhood data yet because we haven't started to dissect it. So I can't say much there, but about the, I mean, we have another huge data set, which is the data set for the calibration and the performance assessment for the low-cost sensors. We saw a lot of trends there, and there's a report that we published about this. I'm actually going to put it in the chat box. And I think, Kathy, you covered that well as well, but I feel like the question is more about the neighborhood rather than the low-cost sensors. So
I will say that data, that report will be released in a year after we started data collection, which will be January 2022.
And I will throw out there that I believe that if there are anyone out there that wants to, once this data is collected and everything, that it's going to be open records, I believe. So if you're a researcher and you want to see this data, then I think get in touch with Kathy, and she can see about sharing it. But I have looked at bits and pieces, but I don't have any trends or anything yet that I would care to share.
But I will also say, sorry to interrupt you. I'm sorry, Kevin, because I just realized we're almost at time. The last piece is the city is working on a dashboard. So, but it was really important to understand how to represent the data before that launches.
Yes. And I think that concludes it. We're a little bit over time, but I just want to say thank you so much. This topic, as you people can probably tell, is something that's very interesting to me, and I could talk about it all day long. It really is kind of a fun topic and a great thing. And Dr. Kreis, thank you for coming in and joining us. You brought a lot to the table. Kathy, as always, thank you. Just keep working and keep doing what we're doing. And Gerardo, thank you very much. Greatly appreciate the EPA coming in, and you know, it's always a pleasure to work with the EPA. I've had the opportunity to do that over the years, and it's a lot more fun now that I'm working for the city than it used to be when I was in industry, and and I had a little different relationship with the EPA, but that's understandable, and but always professional. So thank you very much. And with that, I'm going to turn it back over to Jordan at the library, and thank everyone for attending. Next week we are going to have Texas Trees Foundation come in, and they're going to talk about the Urban Forest Master Plan, and hopefully we can get them to talk a little bit about the project at the Southwest Medical District that Kathy spoke of. And we also have a couple of people coming in from the Parkland Center for Clinical Innovation, PCCI, and they're going to talk about how air pollution impacts health. And they're going to bring a little bit of a different focus. They're going to bring a little bit of a focus on indoor air quality to the presentation. So I think we can all learn from that, even me. And with that, Jordan, all yours.
All right. Thanks, Kevin. And thank you, everybody, for joining us. Thanks especially to our presenters for sharing their wisdom with us today and all the resources we had. Keep in mind, you can review this event on our YouTube page if you ever want to go back to it and take another look. We will see you on Monday for Grow With Us. And thanks for coming again. Have a good afternoon, everyone.
Thank you so much. Good to be here. Bye-bye.
Thanks to everyone. Bye-bye.